So how is fat stored in the body? So fat is stored in what is called fat cells. There are specialized cells for this purpose. You know stem cell, you heard of stem cells, right? So stem cells can become different type of cells. And in one time, if you are having a lot of energy coming to your body, you tell your send signal to your stem cells that become fat cells. So they take on the job of becoming fat cells. That's called commitment. So they are commissioned now to become fat cells. Till then they were just stem cells in adults also. So this is pre-adipocytes or pre-fat cells. So right up there is a pre-fat cell. Now it's commissioned to become a fat cell. It will accumulate. It will take all these lipid droplets. You see these globules, like yellow globules. That's how it will start accumulating fat inside the cell and then becomes a full-fledged adipocytes or a fat cell. So fat in our body is stored in specialized cells like these. They're called fat cells. Here is an example from our lab. This is how fat cells look like. On your left side is picture of mostly pre-adipocyte. There are very few fat cells in them, but what red color is the fat there. So you will see those red circles that are those fat globules that I just talked about. And this is when they look like when they become full adipocyte. Most of them are fat cells now here on your right side. And all these get stored in the body in specialized depots called fat depots. Now there is something about this. These fat cells get stored in either specific places such as thighs or hips or chest or back or abdomen or inside the abdomen or in your organs. There is peculiarity about fat storage. It does not get just about everywhere in your body. I have not seen people getting fat stored in their ears, right? No fat here. So there are certain places fat will not go somehow, and certain places it will go. Another funny thing I found is that it has a very symmetrical distribution. Have you seen fat only going in one thigh and not the other thigh? You losing weight only from this side of the abdomen and not that side of the abdomen. Doesn't happen. We don't know. I don't know what's the reason here, why that happens. It's a mystery. I would love to know that so that we have more control over these distributions, and then we can treat people that way. But today we don't know. So we're talking about fat that is stored above the waist, above your belt line, so to say, above the waist. That's the abdominal fat, and that fat could be inside the abdomen. What that means is, so you have skin first, then there is fat, then there is muscle. Then there is a compartment called peritoneum where you have your intestines and kidneys and liver and all the organs stored. That is the intra-abdominal, inside the abdomen. So if you have fat, more fat in that compartment around your organs, intestines, around that is the fat that is called intra-abdominal fat, and that is a fat that is health-wise most dangerous type of fat. That is the main point I want to make today. So that's the fat, abdominal fat, that is linked with diabetes, heart disease, and risk of early death. So more abdominal fat you have, greater health risk you have. And if you take two people, now we talked about body mass index, right? We know BMI. You take two people with same BMI, 30 and 30. If you have a person who has more abdominal fat is the one who has greater health risk. That is true even if you are not obese. And let me give you some examples. You may or may not have heard the term metabolically healthy obesity. Metabolically healthy obesity is nothing but simply people who are obese but metabolically healthy. So if you check them, do the blood tests or what have you, you will find that these people are 250 pounds, whatever the weight. But they don't have diabetes, their cholesterol is normal, their triglycerides are normal, blood pressure is just fine. So those are obese people, yet metabolically healthy. So they are very important for research, because I'll tell you why. Because we can see what they are doing right, meaning what their body is doing right, so that we can harness that and then apply that for treatment. So that's how they are, in that sense, they're valuable for research. Anyway, so that's metabolically healthy obesity, and that could be because they may not have abdominal fat as much. They may be obese, but not storing as much fat in their abdomen. Another example, opposite direction, is Asians. Now, that's, I personally, for research purposes, don't like the word Asian because it combines so many ethnicities in just one group, you know, and they may have their different physiologies, but we don't have the ability to differentiate them into Chinese and Indian and what have you, so everybody is lumped together in one word. And if you, Asians as such have greater risk of obesity at lower BMI. So if you compare an Asian and Caucasian, if both have same BMI, the Asian person will have greater risk, health risk. And that could be because they have more fat in the abdomen. Here are some illustrations of what I just taught. Let's consider these two people, Mr. John, Mr. Jack. And they both have the same BMI, 30 and 30. But Mr. John has bigger waistline. So that's the person, Mr. John, is more at risk from this fat that is stored. A different example, you're looking at two people with normal BMI, 24, not 30 BMI. Yet, between the two of them, the person who has greater abdominal girth, waistline, is going to have greater health risk. Another question, why? Why is abdominal fat linked with diabetes and all these conditions, right? Why? And the answer to that, it seems, is abdominal fat is a marker for fat in the liver. And there's a researcher, others have done it too, but there is a researcher, Dr. Sam Klein, who is at Washington University in St. Louis. He has done very elegant studies, a series of studies to show this, that it is really the risk is coming from the fat that is stored in the liver. So when you have big storage of fat in the abdomen, that's what we see, but it is really the fat in the liver that matters in terms of your health risk. So here is an example. This is from our lab. These are pictures from mice liver. And on your extreme left is how a normal liver would look like. So pink color is like glycogen stored. Remember we talked about glycogen. And white spots is where fat would be stored. And as you see liver start deteriorating and accumulating more fat, you'll see more and more white color. That's fat getting stored in the body, in the liver. And what that does is it impairs liver function. When there is so much fat stored in the liver, it impairs liver function, and liver has major effect on your metabolism, and that's going to eventually lead to diabetes or other metabolic problems or what have you. So what we know that another example, if you take two people, same BMI, same waistline, but one has more fat in the liver and one doesn't. Who is at more risk? A person with more liver fat. Another case, two people, same BMI, one has greater waistline, but the fat in the liver is the same for both of them, their risk will be similar. So what's driving here, the point I'm saying is what's driving your risk is how much fat is in your liver. So we started out by saying that excess fat, as marked by your BMI, is linked with greater health risk. We started out with that. Then we said, wait a minute, but it's not only that. What really matters within that excess fat is how much fat is in your abdomen, right? And then we are further now sharpening it, focusing it down to not only in abdomen, what really matters is what's in your liver. So from total body fat to abdominal fat to fat in the liver, that matters. It is possible to look at how much fat is in the liver. There are procedures one can do to find out. It can be done. It's not done routinely. But that's why we have markers for liver fat, and that marker is your waistline. that is a good marker to determine. Abdominal fat is a good marker to tell how much fat is in your organs, such as the liver. Here is a way to measure that. Now, please note, your waistline is not the same as your trouser size, okay? Two separate things. You may wear your trouser wherever you like and whichever size you have. So, now this person is wearing here, somebody may wear it here. That's not, your trouser size is not your waistline. Your waistline, strictly speaking, that we need for our purposes is by your umbilicus, okay? So stand like that without, preferably no cloth or clothes where you're measuring, and your tape needs to be parallel to the ground, okay? Not up, not down. Don't find the smallest spot possible. So it's not fooling yourself. It's not going to help you there. So, and take your measurement. And that reading is going to tell you whether you make this cutoff, which side of the cutoff you are on. Okay, I'm going to ask you that, what do you think is that number? That this number is the cutoff. Beyond that, you have higher risk, and below that, you have lower risk. What do you think that number would be in inches? 35. 40. Who said 57? Somebody said. That's not right. Okay, I'm going to give only one number today, and that number is 40. Okay? There are various numbers for various other things. People, Asian people have different number. Women have a different number. I don't want to confuse you all by giving so many numbers that when you go home, what are they saying? Maybe it's a 30, maybe it's a 50. So 40 it is, okay? If you want any other number, please ask me, I will tell you, okay? But 40, for men, 40. Now, because you're 39.9, don't start celebrating, okay? It's not, oh, fine, you know, don't need to worry about it for the next 3 years, you know. This risk, we are all so good at fooling ourselves. This risk is continuous, okay? So what I mean, it's a continuum. What I mean by that is, but we have to pick a number beyond which it increases, and that number is 40. Doesn't mean that if you're 40.1, you're terrible, and 39.9, you're just off the hook kind of thing. So that's just a guideline for you to know how far you are. And, you know, like the biggest measurement I have had taken of a patient was 76 inches. Yeah, huge. And in that case, it shows what obesity, how obesity is a disease. It is not possible in that case to have a perfectly parallel tape measure, obviously. But you don't need either, you know. You don't need a tape to see that you are above 40 if you are 76, you know. So, so that's what I'm trying to say. It's a sort of a guideline for you, that 40.